Oh yeah, okay, well, great. So welcome everyone to our session this morning, this afternoon, this evening, called Resourcing Global LGBTI Issues in the Era of COVID. We can, oh, great, this is the right slide. My name is Matthew Hart. I'm the director of the Global Philanthropy Project. And before we get started, I wanted to thank the really remarkable staff of Outright International for producing such a really incredible summit. It's been a real joy and a really wonderful launch last night. And I also want to thank the Outright Board of Directors, all their donors, the founding community for helping make the conditions possible for this kind of very consequential discussions that are being had all week. And before we get going, we're about to talk about data and trends and structural responses to COVID. But before I do that, I'd like to just acknowledge the humanity of the pandemic. As of today, reportedly 70 million people have died as a result of COVID-19. And these are our family members, our colleagues, our friends, lovers, comrades, and more. And many of us will be negotiating the long-term health impacts of these losses in our own lives, in our own bodies, and in our own communities. So it's in their memory, and do we lean into this work right now so that at this moment we can do the most that we can in the roles and positions we have. And I really want to thank the speakers who I'll introduce shortly, also for participating, and my colleagues at GPP who helped prepare this presentation. So let's go to the next slide. As we do at GPP, this is just an organization of how we're going to spend our time together. First, I'll present some of the findings of a report that will be officially launching at the end of January. You can sign up for that at a link at the bottom of this screen, I think. And the report is called "Where Are the Global LGBTI or Global COVID-19 Resource Communities?" And then we have funders who have navigated and negotiated this pandemic. And they're going to reflect on really what it's meant to them in their leadership roles and from their institutions. And then we're going to open up for questions and answers. So that's where we're going to spend our time together today. I want to also appreciate that everybody who chose to come to this session and be a part of this conversation. It's very meaningful for us. So we can go to the next slide. For those of you who don't know, I'll quickly explain it. It's a collaboration of 21 private and public foundations and philanthropic advisors. And together we work to expand financial support to advance human rights for LGBTI people in the global South and East. GPP commissions public and private research. We support member working groups and task forces. We host donor pre-conferences in advance of civil society gatherings around the world. And we work with a cohort of wealth advisors. We regularly host member-only telebriefings, as well as webinars, or participate in web-based events, such as this one today, in partnership with our broader philanthropic and development and civil society partners. So once again, we're really grateful to be here. So we can go to the next slide. So I'm going to give you a little snapshot about what we're going to walk into right now. COVID-19 is exacerbating our existences and the vulnerabilities of LGBTI communities in many parts of the world. And at the same time, donor responses to the health impacts of the pandemic are reshaping international development, humanitarian, and human rights financing. So today, Global Philanthropy Project, and I'll be walking us through this, we'll be presenting some key findings from our forthcoming report. And that really digs into the global LGBTI funding landscape and includes predictive analysis based on a survey of 25 funders who account for just about half of all funding outside the United States. So data from the Global Resources Report will also be shared and compared within this report. And we hope to highlight some of the key thematic and population-based trends that we've learned about also. After, we'll have a 3-person panel, which you can, that I'll be introducing. And that represents a government donor, a private global donor, and a regional movement-based participatory funder. So hopefully from their unique perspectives, we're gonna get some insights on really how different kinds of individuals and institutions who are involved in resourcing movements are addressing the challenges and complexities of this very new reality called COVID for us. So with that, let's jump into the next piece. And this is the great slide, Marina. I think stay here, please. So in April 2020, the Global Philanthropy Project launched a survey to all of our GPP members, as well as non-GPP members within the top 20 funders of global LGBTI issues. So in order to understand the initial response of the global LGBTI philanthropy to the pandemic. And a key outcome from that report was that we identified for ourselves within GPP a role to monitor these shifts in resource flows to LGBTI communities, as well as the broader impact of COVID-19 on international development and humanitarian assistance. So 6 months into the pandemic now, we are, report is now being produced. So we can go to this next slide, please. So more than 80% of LGBTI funders who responded to the GPP COVID-19 survey said that many or most of their grantee partners had shifted focus from existing programs to providing services to reduce the spread of COVID-19 among their communities, 80%. Similarly, more than 80% of funders said that many or most of their grantee partners had shifted their focus from existing programs to providing livelihood, shelter, legal assistance, or other forms of support to address the impact of COVID-19. And this aligns really well, actually, with the analysis of the applications received by Outright's emergency COVID-19 fund, where more than 80% in those findings were also focused on providing humanitarian relief to LGBTI people. So we can go to the next one. So an important finding, and very relevant to this conversation and to those of you who are with us today, is that among those 24 LGBTI funders who provided GPP with their forecasted budgets for LGBTI grants in 2021, so next calendar year, the total funding for LGBTI issues, excluding domestic US, is expected to actually increase by 20% from the 2018 levels. So from 90 million in so up to 90 million in 2021 versus 71 million in 2018. And 19 of those funders indicated that their LGBTI funding will increase, while 3 of them said that they will increase, or decrease rather, and 2 said they would stay the same. So 24 said they'll increase, 3 said they will decrease, and 2 said they will remain the same. We can go to the next slide. So from our April survey, 85% of the respondents had adopted very flexible funding practices. So extending grant timelines or reporting requirements or eliminating them. And almost 70% had allowed their funding to shift from project or programmatic funding to general operating expenses. So basically leaning back and allowing the money to be more fluid and adaptable. And it's important to note that the existing funders of LGBTI organizations, including the 24 who participated in the survey, are largely human rights funders or have adopted a rights-based approach to their grant making. And the representatives of the 4 government donors that responded all work within human rights related program areas within their respected agencies and agendas. So collectively in 2018, these 24 funders awarded about 2/3 of their grants for civil and humanitarian rights, or human rights rather. Only 5% for economic issues or health and well-being, and more than half of their grants in 2018 supported advocacy. And importantly, only 1.3% of all grants supported direct services. So you can see this is a field not accustomed to funding humanitarian work. We can go to the next slide. We're going to be taking questions at the end too, so if you want to drop them in the chat while I'm presenting this and talking to our guests, then I welcome you to do that. So as the global pandemic was declared in March 2020, the UN Office for the Coordination of Humanitarian Affairs released the UN COVID-19 Global Humanitarian Response Plan. So it has a very glamorous acronym, GHRP. And that outlined a coordinated response plan for the international humanitarian system. There was very limited mention of LGBTI issues in the original document. However, an updated GHRP, right, which is this Global Humanitarian Response Plan, I think we're all going to have to know what this is, was published in 2020, in July of 2020, and that document was updated and had more LGBTI language in it, and more details about how LGBTI people were specifically an at-risk population within the COVID-19 pandemic. I'm sure by a lot of advocacy of people on this call or who are involved in this work. We can go to the next slide. So as of November 11th, we're going to talk about the scale of money we're talking about now. Over $6 billion had been committed by governments and multilateral donors, as well as some private sources, to address the humanitarian impact of global COVID-19 pandemic. And based on the data available from HA's financial tracking service database, which we'll have access to, just over half of that funding, so about $3.5 billion, was tied to Global Humanitarian Response Plan. In other words, it tracked directly to that plan as outlined, with the remaining dispersed through a range of humanitarian funds, appeals, and mechanisms. And of the 4,467 recorded resource flows addressing COVID-19, only one explicitly described funding support for LGBTI communities. Right, that is extraordinary. So as the project description for individual resource flows on the FTS, it often provides very limited detail in review of the response plans, but public statements and official website information that we reviewed and made an analysis of from the largest donors identified through the FTS was undertaken. So we sort of moved out of the data set and then looked at the actual institutional response plans themselves. And among the top 5 donors who account for more than half of all those humanitarian resources committed to addressing the impact of global pandemic, none explicitly identified LGBTI communities as a priority vulnerability or vulnerable population or at-risk population. And oftentimes these are identified in excruciating details, the populations that are most vulnerable, and we are absent from all of them. And a review of the top 20 recipients of humanitarian funding, so secondary donors, those who receive money to re-grant, and we did that through the FTS, it's basically the exact same picture. So the exclusion of LGBTI communities as a considered population, let alone a priority population within COVID-19 response plans and public statements suggest that humanitarian resources pledged by the world's largest donors are systematically not directed to or targeting the needs of LGBTI communities in any way. Go to the next slide. So here's some possible impacts, and then we're going to turn to our colleagues here and open up this conversation after I've sort of laid out some of these stark and damning findings. Some of what's going on is that already overburdened LGBTI organizations are being stretched beyond their competencies and capacities because humanitarian organizations are not being inclusive or explicitly including LGBTI people. Another impact, capacity of human rights, the capacity of our movement to respond to the human rights attacks that we're currently under is being undermined because we are doing the work of humanitarian response. And there's really an opportunity here too in this COVID crisis to break down the very real invisibility of LGBTI people and our community's issues within the international humanitarian system. And addressing humanitarian needs will require new skills and relationships for both LGBTI groups and grant makers, as well as humanitarian actors. It's basically a brand new day. So with that, I'm going to pivot now to our panel. I thank again everybody who is here joining us on the session, as well, of course, as our speakers I'm going to introduce right now. But if you have any questions, you can ask them in the chat. And this report will be launched in late January, and there's a link at the bottom of the page that you can sign up to receive updates about the about that. So, why don't we go to the slide? So we have 3 speakers today. Our first speaker, well, not in the order that they'll be speaking, is Caroline Kwasiyaman, who's the executive director of ISDAO. Michael Heflin, who's the director of Equity, Equality, Human Rights Initiative at Open Society Foundation, and Elaine Shard, of the Foreign Commonwealth and Development Office in the UK government. So it's super to have you all here. I really appreciate your time and your willingness to participate here. So I'm going to jump right in with some questions, and I'll be looking at some of the chats to make sure that if there's anything out there that I can bring into our talk, I will. So Michael, I'm going to start with you. Thanks again for making time in your really busy schedule, end of the year, to join us. Here's my question. So there are different ways that donors can respond in short and midterm in this crisis. What do you think the next several months or even 18 months will look like for our historic LGBTI grant-making community?
Thanks, Matthew. As Matthew said, I'm Michael Heflin. I'm with Open Society Foundations, and I work in a global thematic human rights grant-making program where I direct the equality work, including our work on LGBTI rights. And I guess before I try to answer your question, just first of all to say to all the participants, happy International Human Rights Day. I think it's important to recognize that that's the day we're in, and recognize the importance of that day and the importance of us for all being here on this day, and also to thank, again, Outright International for organizing the summit. So when I think about the next several months, I think, about several things. First of all, the pandemic itself, the situation is still very fluid. It's still evolving, and while there's hope, of course, with the vaccines that are now moving forward, but whether and how those vaccines will be distributed, how quickly, how fairly, are really serious concerns. And I think for the LGBTI community, what we saw at the moment that the pandemic really unfolded was, that our queer community in many places in the world, because of systemic oppression, discrimination, stigma, was really at the back of the line in terms of getting access to the kind of humanitarian assistance that was needed. And I assume that without strong advocacy at different levels by ourselves as donors to this field, by the civil society partners that we work with at the global, regional, and national level across the world, without strong advocacy, our communities will also be at the back of the line in terms of getting access to vaccines, access to the kinds of more sophisticated health treatments for those who do contract COVID. So I think we can't take our eyes off the ball. I think that in the next several months, there'll be a continued need for us as donors to be seeing how things unfold, to be flexible in terms of our support. One of the really inspiring things about the report, Maddie, and I wanted to congratulate you and the other staff at GPP also for this excellent report, is, I think LGBTI grant makers by and large really did step up and really did create a lot more flexibility in their grant making in response to the pandemic. I can say for us at Open Society Foundations, there was a strong decision to really step up and to really, play our role in trying to respond to the pandemic. And that included things like being more flexible. Most of our grants already are core funding grants, but because we're a human rights funder, as you said, we don't tend to fund humanitarian assistance or direct relief. And so I think it's really a credit to different LGBTI grant makers that they really were able to create that kind of flexibility for our partners. There's a cost side of that, which maybe I'll talk about in a follow-up question, but on the positive side, I think there was that kind of flexibility. But I think that's going to need to continue for the next several months. And then kind of looking beyond more midterm, just to say quickly, I think what the report just spells out in such stark relief is the lack of sensitivity, the lack of awareness among humanitarian donors and implementers about the impact of humanitarian crises, and a global crisis in this case, on community like ours. And so there's a lot of work that we'll have to do to really engage those donors, because we aren't going to be able to do it ourselves. As much as the flexibility has been good, we've only been able to reach, I think, a fraction of the need that's out there.
Yeah, thank you, Michael, for that. And I will follow up with you on that other question for sure. Carolyn, I'm going to come to you. You're the executive director of ISDAO, and maybe you can do a little introduction of that when you begin. But here's my question for you. Part of this presentation is about kind of capital and backroom or backdoor donors that are funding at enormous scale, right? $6 billion. And in our wildest, greatest imaginations, those resources would flow and connect our communities in natural and competent manners. But given that many country-level implementation partners for humanitarian aid are faith-based and risk having trans and homophobic policies, how can grant makers support the capacity development for national level activists to hold these institutions accountable? Big question, but thank you.
Oh, just a small minor question. Yeah. Thank you so much, Matthew, for the question, and thank you to Outright National for also creating this space where we can have these conversations. As Matthew said, my name is Caroline Kwasi Ama. I'm the executive director of ISDAO, which stands for Initiative Sankophage de l'Afrique de l'Ouest. And we are a LGBTQI West African activist-led fund and organization working across 9 focal countries in the region right now, really to build a more just and inclusive West Africa that is fully inclusive of our communities, is free of stigma and discrimination and violence. And how our vision of how we do that is by supporting the leadership of people who those decision-making rooms with humanitarian organizations are often not even those consultations, the country consultations, those rapid assessments that happen are unfortunately often not in those spaces, and part of our vision is to ensure that they are in those spaces. So grant making is part of the work that we do, but philanthropic advocacy is another key part of the work that we do. I think your question is interesting because in some ways, there are limits. How do you hold faith-based private organizations and foundations accountable for policies that they don't have, policies of inclusion that they don't have, and that they may not ever have an intention of having? I think is very different than how do you hold humanitarian organizations where maybe a branch of a broader, at a country level, maybe broader, branch of a broader organization like a Save the Children or like the CARE, whose core work might not be humanitarian, but are still important humanitarian actors. So I think we also have to unpack and recognize that the dynamics are different. But I want to talk in general about what are the things I see that ISDAO and other funders can do, and broadly what philanthropy can do in terms of supporting the work. I mean, one of the things that has been really critical has been the kind of documentation of community needs, community experiences. I think certainly the work that Outright has done around documentation of the impact of COVID, I've seen it actually being referenced by grantee partners around the needs. We've also seen our partners themselves do documentation of the community experiences. Having that evidence around what are the needs and where are the gaps is really incredible and really important. So I think there's a role that we can play in terms of supporting documentation and research. We don't, as human rights funders and LGBTI funders ourselves, nor do our partners, do enough work around budget and financial flows tracking. I think supporting work around actually understanding what money is coming in for development work and humanitarian work in our countries, where is it going, and how do you engage in accountability systems as citizens? We don't do enough of, and I think there's important work to be done around that. I also want to recognize that in many of the countries that we work at ISDAO, our partners are already engaged in advocacy spaces. They're already engaged with international organizations. And so what I think the work that needs to happen is also around supporting the work that's already in existence, because some of those institutions are already targets for advocacy. So continuing to support that work through flexible work. I think the other key thing that what COVID-19 is teaching us is of the importance of cross-movement coalitions, cross-movement consortium, because while we may have different experiences, we may have obviously different access to humanitarian aid, there are also some broad based ways in which the COVID crisis is affecting us at a macro and at an organizational and a community level. And this moment has really taught us the importance of engaging with those that are fighting around universal health care, that are fighting around anti-poverty, that are part of the conversations around economic recovery. And so I think as funders, investing in spaces and opportunities for cross-movement coalition work is really important. And I think obviously how we can communicate and share more of the information that we're getting. So as funders, once this report is released, how do we engage with our partners around it? How do we ensure that our partners know about this data? How do we also support strategy sessions? I think that those kinds of things, as much as we're responding to the immediate needs that this crisis has both created and exacerbated, I think there's important work that as funders that we can do as grant makers around strategy work and supporting our partners to undertake that strategy work and that cross-movement building work. So those are some of the things that I'm already thinking about, ways in which we can engage this research and make this data more accessible for our partners in their advocacy efforts.
Maddie, we can't hear you.
Sorry, thank you. I was affirming Caroline's statement that there is always this push-pull between, activating capital investments at the capital level, and then really investing in the leadership of local activists who can build power in ways to pull those resources in ways that are appropriate and of a shared design. So thank you for that. It's really clear. And I posted a link in the chat for everyone to see that you can go and read everyone's bios, but also go to their organizational website. So take a look at that. So now I'm coming to Elaine Shard. Elaine, thank you so much for joining us this afternoon. We really appreciate it. And it's great to have you here. I have a couple questions for you. And so I'm gonna jump right in here with a question about sort of the role of government. So the report highlights that the UK government is one of the 5 major donors on global humanitarian responses to COVID-19. So my question is, what role can major donor governments like the UK, which has prioritized LGBTI rights globally within its foreign policy, how can they play in influencing other development actors in humanitarian response systems to increase the of LGBTI communities humanitarian response and really in future humanitarian action? And you are muted, so just so you know.
I thought somebody muted me. I'm on. Hi, thank you so much for inviting me today. And I'm sorry that I can't get my camera to work, but I am Elaine Shards. I am from the UK government. I work for the Foreign Commonwealth and Development Office. Thank you for your question, Matthew. I think one of the issues that governments face is the fact that we usually divide up our departments between policy and the development department, which is where the humanitarian policy usually sits. So, for example, in the UK government, we have just merged. So we're not the Foreign Office anymore. We're now the Foreign Commonwealth and Development Office, which I think gives us a better strategic approach when we are responding to situations such as this. I can't take the credit for what was previously DFID, our development department did, but in terms of the reaction, I think the view was that vulnerable groups and including LGBT individuals will experience crises such as COVID-19 outbreaks. So the crises are likely to reinforce the marginalisation position that already exists in society, their experience of discrimination and violence and stigma, and further limit their access to essential support and services. So the UK government, for that reason, issued guidance, circulated guidance across the department, highlighting that inclusion has to be central to our response, and the specific context and needs of vulnerable groups need to be taken into account when developing practical programs. So I got the sense that we sort of started off at a good point in terms of we were all facing this COVID-19, but it was basically how we just kicked off in our approach. I think I would just quite like to add that the UK is currently the co-chair of the Equal Rights Coalition, and the strategy that we are drafting, which we're hoping to now launch in January, does combine more of the policy and development and therefore humanitarian aspects into the strategy that the member states will be taking forward. So I think it is perhaps that we need to learn from perhaps our unreadiness in the face of COVID-19, learning those lessons, learning from each other, which we certainly try to do, certainly within the Equal Rights Coalition, so that we can all be better prepared should something like this happen again.
Thanks. Thank you for that. I'm going to come back with a follow-up question for you about that too, but I'm going to sort of circle back to Michael here and invite you back in on this. You know, earlier you were talking about how there are cost implications for a big institution like OSF reassigning existing and, you know, defined amount of resources towards a global crisis like this. And that has a sort of cascade effect in other departments and teams in terms of resources that are available in traditional ways. So I guess what kind of trade-offs are, or not trade-offs, but what sort of considerations have to get made in the coming months as the impact of those new investments for COVID response are being made, while at the same time, there's just a finite amount of money that's able to get spent each year. And how would that, what's the timeline, do you think, of how long big institutions like OSF would necessarily be making these structural shifts to accommodate COVID as a significant new investment?
Great. Thanks, Maddie. And I'm going to be a little bit like a politician. I'm going to answer your question, but first I'm going to pick up on a couple of points that my colleagues on the panel made. I just wanted to pick up on, as much as I do think it's important that, given the way that we've seen this play out, that we, as a queer movement globally, and including donors that are grant makers to this movement, need to think about how we engage humanitarian actors. I also think, and this is something within Open Society that we have been discussing, especially with our regional programs and our national foundations, is, the pandemic really exposed the gaps, of course, in social protection systems, and then particularly how those gaps, impacted marginalized groups or groups that are at most risk, including LGBTI communities. And so one of the things that we've been talking about, as everyone talks about Build Back Better, is to how we can strengthen the capacity of our partners to do advocacy around those social protection systems and the inclusion of the needs of LGBTI communities, in those social protection systems. And for me, that also then kind of goes down to another level, which is really around development assistance in general. And again, I know that there's been a lot of work, and GPP's done a lot of work, Outright has done a lot of work. There was, work to engage big actors like UNDP and the Global Bank around development indicators that are inclusive of LGBTI people. And also there's a lot of innovative work at the national level that's happening. But I think that's really a place where thinking about how we support the LGBTI movement to have an advocacy, more sophisticated advocacy strategy around accessing basic economic opportunities, economic rights, social protection. These are areas that I think we need to think about more deeply in response to the pandemic. To answer your question, for us as a more typical, generally human rights funder, so we're funding human rights advocacy to advance laws and policies to protect people from better, to build movements, to mobilize constituencies, to change public attitudes. There was costs related to making the decision to respond to the pandemic in a big way and create the kind of flexibility that we did. And I think I see those costs in two ways. I mean, one is, enabling our partners, which I think was the right thing to do, our grantees, to use their funding more flexibly, was one of those things. And in general, I think that we've been moving in that direction, and that's something that partners around the world have been asking of us as donors in general. And I think the pandemic, spoke to the need to do that. But that meant that, for those groups and partners, some of the other kind of advocacy work that they might have been doing, with our funding otherwise, had to be set aside, and again, in many cases where the pandemic hit really hard, some of that advocacy may not have been able to happen anyhow. But I do think that there's a cost there. And as you say, those groups stretching themselves to try to take on areas of work that aren't necessarily, within their own mandate or mission or capacity. I think the other thing that happened was, within Open Society, we shifted significant part of our own budgets, our regular programming budgets, to really have a stepped up response to COVID. And again, at the moment, I think that doing that made sense, but that meant that there was less funds available for the kinds of more traditional human rights advocacy that we would have typically funded. And so for some partners, it meant that we were able to renew their grants, but not for the same length of time, the multi-year length that we typically try to do, or that we weren't able to start new work. Or in some places, even with the pandemic, there were strategic opportunities to move forward on advocacy efforts, and we weren't able to support those because a lot of the funding was shifted toward COVID response.
Very real. Thank you for that, Michael. I'm hoping that people who are joining us for this session today Part of the purpose of this is to not only share with you the kind of rather damning data that we pulled together about humanitarian response and their specific inclusion of LGBTI people, but also to give some insight into how those grantmakers who are explicitly inclusive or only focused on LGBTI people are also negotiating and navigating these times where resources need to be reallocated and new strategies are working together, are coming together. And I want to pivot over to you. So I guess, ISDAO is a relatively new fund, and yet it's activated an entire real sector of philanthropy to attend to and understand in new ways about the needs and conditions and opportunities to invest in leadership in the region that ISDAO is working in. I'm wondering if you could talk a little bit about the kind of ways that you and your partners have shifted during this time in order to maintain a kind of a narrative, a consistent narrative to a set of external actors that didn't have access to this region in the past. So part of your work has been to tell the stories and to elevate the opportunities for investment in the region. With COVID, things got disrupted. What were some of the ways that you went about your work to ensure that the communities that ISDAO is investing in don't get lost in the shuffle?
Thank you, Matthew, for that question. Yes, I mean, the reality is being a regionally based fund working in the region with staff in the region, the realities that impact our grantee partners are shared realities that we ourselves face. I mean, what has been consistently important from ISDAO from the very beginning is being a flexible grant maker. And so ensuring that that level of flexibility really translates and is emphasized during this time. So obviously we're already a flexible grant maker, but we reaffirm that flexibility with grantee partners, not only in terms of how resources could be used, but also even the timeline. Because what we found is that, people had to, even if they said, we're still going to do what we had planned to do, the timeline of what that looked like, how it looked like, for most had shifted significantly. So having that level of flexibility, we also provided we also activated two new sources of resources, one being a Respond Fund, which was the idea of integrating more resources for safety, security, emergency response at a country level and at a grantee level. So there's a pot of resources that exists now within each of the countries where we work that enable, when something happens, to be able to respond to it. Because the reality is, especially in this moment of COVID-19, even kind of the time that it took to engage with our usual donors and, around how to respond, it took everybody longer. I think that's the reality of the field, that a lot of work took longer. And I think we were quite fortunate to have some new emergency funds pop up. The fund at Outright, Dignity, obviously was still there, Rapid Response Fund. So we had some response funds, but not, doesn't cover, is not able to meet all of the needs. Yeah. So having more localized resources readily available was really important. We also introduced what we're calling resilience grants. And these are very flexible, essentially additional top-up grants that are intended to respond to whatever organizations are identifying are key for their resilience. And so we found that some partners, for example, said, we don't know what's going to happen with our other funding. We want to make sure that we've paid our rent for the next year. We don't know what's going to happen. We know how this context is going to shift. We want to pay the internet subscription we want to pay our web domain subscription for the next 5 years to ensure that we can continue to be visible, to do fundraising. And so sometimes when we look at the strategies, yes, there's the responding to community needs, but there are also, what we found is new costs of doing work, new cost of organizing. where you were able to do things with gathering 30 people is no longer a possibility, and that one gathering of 30 people now has to be 3. And so as a funder, being able to respond to that, but also connecting partners, leveraging, doing letters of recommendation, connecting to other sources of funding was incredibly important. But I just wanted to really emphasize the fact that as we're looking at the response and as we're looking at what the future, the cost of organizing is changing, is increasing. The cost of doing core work that we're doing, along with responding to community needs, the cost of doing the core human rights work that we're doing is shifting. And as funders, we need to be responsive to that context, ensuring that flexibility, but also recognizing that we need a broader and a bigger response to that.
Yeah, and we need more money, right?
Yes.
We need to be included in the traditional funds. I mean, that's a big part of this, is that traditional human rights philanthropy cannot be expected to meet the humanitarian needs of our communities alone.
Yes.
So yeah, it's very clear. And I think that's going to be one of the big learnings of all this, is sort of not only, as Michael's saying, like the cost implications for big institutions to do pivots, but political work has shifted and the cost for that is also shifting. And to be able to have those things keep up with each other so that as normalcy emerges in this good time, to, different place at the same place. So I'm going to circle back to Elaine, and I see a couple questions, so I'm going to answer them. We have a couple minutes, so I'm going to invite you in here, Elaine. So here's a question that we talked about actually when we were on our prep call. So most government actors that we as LGBTI organizations and activists and organizers know and work with do not traditionally have responsibility for humanitarian funding in their portfolios, right? And from your position, how can we, folks like yourself in your position, and folks from the movement work together to accelerate the new and necessary relationships that we're going to need right now in the humanitarian sector, in terms of our relationships, introductions, making sure we're going to the right places? How can we work together to accelerate those findings and that access that we need?
I think probably I sort of touched on earlier about specifically for us in the UK, where we've actually merged the 2 departments that have those responsibilities. So the policy and the departments that are responsible for humanitarian aid. So I think that most countries, in response to to COVID-19, in terms of looking at the funding that they have offered, have probably had to merge, if not necessarily the departments, but certainly the thinking in terms of where funding has previously sat from a policy perspective and where it needs to slightly shift to respond to this. I think probably, if I heard your question correctly, in terms of the focus really being on how we can work together, I like to think we started working together in the UK. We are now together, but I think a lot of governments will now be working together, because it wouldn't be possible for a policy department to try to start thinking up how to respond on humanitarian crisis. So I think it's probably already begun, but I think probably the best way is to just keep up with the pressure. I think, speaking from as a government employee, there's nothing like pressure to make you sit up and listen. So I think, again, perhaps going back to the point about lessons learned, that we're all facing this now. I realise that lots of governments, including the UK government, we've got less money because we've all had to deal with this. But I think it is really now starting to think more strategically about how much money we have got and what we're going to do with it, rather than perhaps traditional routes that we might want to stay. I mean, I would caveat that with I don't think we should go charging off with our money in another direction, because we still need to fund, for example, ongoing criminalisation and addressing hate speech, etc. But I think it's got to be more of a strategic approach to make sure we've got it all covered. And I think, really, to answer your question, how do we ensure that we work together to do that, is pressurising governments.
Yeah. This is an excellent platform to message to a broad group of activists that you welcome pressure. So just to say, it's appreciated, and I'm sure heard and will be echoed in the hallways of this summit, that a UK government representative welcomes pressure. So anyway, but thank you for that. And it is clear that we need to have a well-articulated, focused strategy on key targets who are deciders around resources and strategy development in the humanitarian sector to make an impact in this. Us being upset about it and being excluded from it gets us nowhere. And spaces like this and deep recognition of Outright's leadership in this is helping us create the conversation that is necessary for us to do. And I'm gonna pivot to Jessica's question, which is sort of a whole conference. And we have at GPP been thinking about this a lot. So I'll read it to people. Maddie, thanks for the clarity. The exclusion of LGBTIQ populations from COVID-19 humanitarian response is unacceptable. I know that GPP doesn't usually name and shame. We never do. What strategies do we use? What is right for GPP, and what would you recommend for NGOs? I'll do a little bit of a response, and then I'll open it up to the group, and whoever wants to respond, maybe you can just raise your hand, and I'll call on you. That I can say that although the report that we'll release is not designed as a name and shame document, it is a very well documented resource that does identify resource levels and specific kinds of language. So just as the Global Resources Report or anything else, a good read of that report can give you lots of information around key targets, governments who are and are not doing what their public narrative says, and secondary and beyond implementation partners, their geographies, their population focus, and so forth. So there's the goal of this report is to basically provide key information infrastructure to the development of strategies that get us closer to key targets, key people, key geographies. So we're hoping that accelerates the strategy that you're talking about, Jessica, that really does need to be built. And we did this report in service of the development of that strategy. So I'm looking at my colleagues. Elaine, I can't see you, but you can jump in if you want. But Michael or Caroline, any responses to Jessica about like what do we do now? Information in such a starkly documented manner.
Well, I guess from me, this is Michael, obviously, and I think there are different strategies for different actors, and I think with GPP as a group of donors, we also act as advocates with other donors and including bilateral donors, and that's important to continue that work. We also try to build relationships, with other donors and potential donors. So, maybe our tendency is toward a softer kind of advocacy or getting in, on the inside and being able to advocate. But we also, I think, have worked successfully with civil society partners, that are located in countries that are donor governments. So I think the work with the Council for Global Equality in the U.S., which is a group of civil society groups and also donors, but there are members of the council that can exert some of that more kind of external pressure and can put pressure in a different way, on actors. And I would agree with Elaine. I think about the Amsterdam network in Europe and the members of the network, playing a role in advocating with their governments. That with governments, there's nothing more persuasive than knowing that they have a domestic constituency that's actually interested in this and cares about it. So I think that capacity of our movement to actually mobilize that domestic constituency around foreign policy and development issues is another area that we need to focus on.
Yeah. So again, it goes to kind of what Carolyn said so clearly earlier, is that push-pull between like getting capital activated and also ensuring that the leadership at country levels have the resources they need to do the work there. So, and then of course the global solidarity for us to work together. Caroline, did you have a response to that? You don't have to, but I just want to.
No, I think I'm still thinking through that question, and I look forward to the engagement that we can have as a movement, as a community, once that research is produced. I wonder at the country level, where are the opportunities to engage with missions of the governments that fund some of these humanitarian organizations and humanitarian work. What kind of advocacy can be done at a local level, at a country level, at a regional level that connects to sources of funding? Sometimes it being able to, I think, looking at how do you hold those who have the pocketbook accountable for, if they say they have a national feminist policy, is the funding that is being awarded to international organizations aligned with that? How can we look at holding the source of resources also accountable? So I don't know exactly fully what that strategy looks like, but it feels like something that's important.
Yeah. Elaine, any last words before I do my thanks and sign us off?
I think probably I have quite a limited perspective, I guess, because I'm sitting in a government seat. But I think that in the UK, we're really lucky because we have a wonderful civil society who talk to us all the time, and they're really on the ball. And I think that I benefit from a great relationship with having activists who are knowledgeable and prepared to come and speak to government. That may well not be the case everywhere, but I think that kind of relationship is very, very important, because wily NGOs can manipulate governments and manipulate, maybe not the right word, but help to guide and shape them to the good, to the greater good. And I think that having that relationship where we both benefit, that being the activist and government, is the best thing to have. So yeah, I think that's my final thought. Thank you.
Yeah, I really appreciate it, and I want to thank the 3 speakers today. And there is a link in our chats for a session evaluation that Outright is requesting that we consider completing, and love a survey, so I'll be doing it, so join me over there. But I want to thank all of you for joining us on the call, and I want to thank, of course, all of our speakers, the authors and co-authors and respondents to the report, the readers, and together with our collective participation in this report and civil society leadership, like those of us on this call and from Outright, we're really turning the corner in resource mobilization for LGBTI communities and movements, and this is a new front. And as we work to reconcile and resolve movement funding inequities, this report, we hope, provides much needed information to build a roadmap to finance our collective efforts and futures. I'd like to thank my colleagues from GPP, Marina Gonzalez-Flores, Ezra Nippon, and Dave Scamell. And then I want to thank the executive committee of GPP and all of our 21 members. And of course, the Outright team, the leadership that they provided, and the grace in which they've enabled so many people from around the world. I think the last count was 1,400 people are participating in this summit. So thanks so much to your leadership in this regard also. I look forward to working with everybody on this and much more. Have a great rest of your afternoon or evening.
Thank you.
Thank you.
Bye. Bye, everyone.
Bye.
I'm waving. You can't see me, but I'm waving. Thank you.
Bye.